Hi, my name is Emma Pfeffer, and this is my video recording for the Pharmacology Module 4 assignment. Based on the first impression of this 54-year-old patient who presents to the emergency department, I would assume that she has a mental disorder as well as possible alcohol dependence, according to Lilly et al. 2017. She is confused and disordered as well as combative, likely because she's in an altered mental state and does not know what's going on. Because she asked the nurse for a bottle, alcohol dependence could be assumed because alcohol does come in bottles. Since she is confused, she would likely use abbreviated or short-term language to convey what she needs, instead of using full sentences just to get the point across. Since she was accusing the EMS of stealing her purse, this also could point to an altered mental status or alcohol dependence and withdrawal because she's unaware of her immediate surroundings or where the purse could have been, according to Lilly et al. 2017. Short-term risk for this patient can include seizure risk because the healthcare team does not exactly know what's going on, so you can't rule any diseases yet, and you want to prepare for the worst-case scenario, and that's according to McLean et al. 2020. Long-term health risks can include renal insufficiency and impairment because of increased alcohol consumption. Since she does smell of stale body odor and urine, she could be homeless, which would lead to a poor diet and living situation. If she's primarily eating small amounts of food or scraps of food from garbage, but yet still drinking a large amount of alcohol, her body starts to rely on the alcohol more so that it gets her, in a way, the calorie intake and keeps the body alive. She's likely experiencing these alcohol withdrawal symptoms, again, according to McLean et al. 2020. If she is homeless, she has a poor living environment, and as soon as she's out of the nurse's care, it's likely that she's going to go back to drinking because that's what was getting her by before. The patient's hands are likely shaking because she's confused and going through alcohol withdrawal, according to McLean et al. 2020. Sometimes when patients are confused, they guard themselves and the muscles can twitch. Since alcohol withdrawal is suspected, this can cause tremors and seizures if a large amount of alcohol intake is completely stopped all at once, again, according to McLean et al. 2020. Her confusion and combativeness is likely a combination of alcohol withdrawal and a mental illness because she is in an unfamiliar place and feels the need to guard herself in order to protect herself. If she is homeless, she has learned how to protect herself on the streets, and that's kept her alive so far, and so her basic survival instincts are kicking in, causing her to fight the staff. And Lilly et al. 2020 states about the fight or flight or freeze response, and so the adrenaline is pumping through her body and she's just fighting to stay alive. This patient does need several assessments before she can be treated and discharged. The first assessment would be to run a toxicology screen to determine what substances are in her bloodstream that can be contributing to her altered mental status. And this would also determine if any suspected substances are not in her body, so that way it would help rule out an overdose or withdrawal symptoms. And that is according to Lilly et al. 2017. If she's able to provide her name, her record should try to be found to determine if she has any previous diagnoses or historical conditions that could relate to the symptoms she's experiencing today. Once those are completed or in process, someone should try to do a physical exam, as long as she's in agreement to it, to determine if she has any injuries that need to be treated. This could take several people to try to calm her down and hold her steady. If she's still combative, a mild sedative can be given so that the staff can do their job to best care and treat her. Once she is stable, an assessment should be done to determine her mental status, as well as have a social worker involved to determine social aspects of health and living situations, and that's according to Lilly et al. 2017. During this process, staff should try to determine if she's supposed to be taking any prescribed medications if they found her chart, because if she is supposed to, if they administer those medications, it could help with the symptoms. The patient, after stabilized, should be admitted for observation or on a psychiatric hold to ensure that she stays stable and is okay to be discharged. In relation to the research question, the treatment of mental illness also often involves medication therapy, talk therapy, and calming techniques. Oftentimes, the patient's primary care provider can manage the medication and place a referral for them to see a therapist. Choi 2019 mentions that the therapist can engage the patient in talk therapy to determine if there is a root of cause that is causing their symptoms with their depression or anxiety. If they do have a root cause that the illness stems from, the therapist can help discuss that with the patient and help them verbalize how they're feeling and what they can do to try and emotionally move on from that time. The therapist can also go through some calming or mind clearing techniques that can help the patient clear their mind and become calmer. These work by regulating their thoughts and breathing to bring them back to their immediate environment and to stop focusing on past or future things that have their attention. And that's according to Choi 2019. It is important to note that some anxiety can come from fictional scenarios that have never happened to this patient. They could be afraid of something and their mind comes up with scenarios that could happen, and then they become anxious about these fake scenarios. It is important for therapists to talk through that with the patient and help them realize what could happen, as well as scenarios that have no likelihood of happening. And that's, again, according to Choi 2019. Insurance reformation needs to take place. Many times, insurance companies will not cover or only cover a small portion of mental health services. This could include one visit with a therapist every few months, when for benefits to occur, patients need to attend sessions monthly or even more frequently. And that's according to Lawrence 2020. Although prescription benefits generally cover one medication from each class, antidepressants and anti-anxiety medications work differently on every person, and the same drug is not often prescribed because of the patient's specific scenario and how they would react. Lawrence 2020 describes that sometimes the insurance will require the patient to try and fail several medications before a prior authorization can be completed to cover a specific medication. This can delay patient care and actually cause them to become suicidal or have a worsening within their mental illness and mental status, and this is detrimental to patient safety. More needs to be done for insurance because mental health is just as important, if not more important, than physical health, and that's according to Lawrence 2020. Thanks.